Greetings, Herle Burlyites. As you know, during these times of isolation and restriction, most of us are holed up in our homes. And despite a few hardships, we're coping. I'm doing these podcasts from my cottage in a highly guarded location somewhere north of Point Pelee, and we just make it work, right? But what about Canadians who don't have a home? Our presenting sponsor, TELUS, recently announced that, as part of their $10 million COVID response commitment, they're giving $250,000 to support homeless and marginalized citizens stay safe and cared for. That funding is going directly to help provide crucial services to those vulnerable populations during the pandemic. COVID-19 assessments, triage service at temporary isolation shelters, personal protection equipment, and cleaning supplies to ensure a clean and safe environment for patients and clinicians, and more. Jackie Lynn, Director of Operations at Boyle Macaulay Health Centre in Alberta, describes the support for visitors of the Edmonton Isolation Shelter like this. The TELUS Friendly Futures Foundation generous support will provide the means to make the space more comfortable and provide necessary support from funding basic clothing, hygiene items, reading materials, and crafts to providing telephones to connect with family and friends, and technology to provide entertainment to pass the time in isolation. As we all adapt to our new normal during this unprecedented time, it's more important than ever to hashtag stay strong, stay connected. Visit telus.com/COVID-19 to learn more. All right, let's get the podcast started. We've had such great response to our two-part pandemic pod, so we're going to keep that going for a while. You, Herle Burlyites, seem to appreciate the in-depth discussion of relevant issues up front, with our political panel coming on in the back half. We're longer now, we get that, but the good news is that it's a podcast, so you can multitask. One show now works out to precisely the time it takes to make a loaf of Herle Burly home isolation banana bread. Because we've got the zeitgeist and we're here to help you through this thing in any way we can. I would suggest you use less butter in your banana bread than perhaps I do. On part one of the pod today, our special guest is Jane Philpott. After a notable career as a family physician, Jane was elected as a Member of Parliament in 2015 and served as a cabinet minister in numerous positions, including Minister of Health, Minister of Indigenous Services, and President of the Treasury Board, until 2019. In February of this year, she was appointed Dean of the Queen's University Faculty of Health Sciences and Director of the School of Medicine. We're going to get Jane's take on COVID preparedness on the pod today, the tragedy surrounding long-term care in this country, her thoughts on opening up the economy, and we'll also talk about her time in government and why it might not have been quite what she expected it to be. For part two of the pod, our political panel, Scott Reid and Jenni Byrne, weigh in on that, plus the new gun control legislation, why this economic crisis is fundamentally different from previous recessions, Jason Kenney's increasing anxiety about the oil patch, and the new Bank of Canada governor. But let's start with Jane Philpott. Jane, I'm so happy to have you on the show. Thank you for coming.
Well, thank you for inviting me.
I always start these podcasts since the pandemic started by asking people how they are. But I kind of know a little bit about how you are because you're not working from home. You are working in a care facility for physically and mentally, developmentally challenged people and trying to protect them from COVID through this process. So tell me just a little bit about your work and what it's like in there. And you know, by gosh, you must feel those people are helpless without you. You must feel a tremendous amount of responsibility.
Well, thanks for asking. It's been an extraordinary few weeks. You mentioned earlier that I am, I guess, between jobs at the moment. My role at Queen's University doesn't start until July. And I had all sorts of wonderful plans for the spring, as did most people, to be traveling and speaking and doing all sorts of interesting things. And obviously all of that got canceled. So I decided to start working in the COVID Assessment Center at Markham Stouffville Hospital, which was a good way to be able to help out and use my clinical skills. And then Easter Sunday morning, I was getting ready to set up the Easter egg hunt, and a text came in saying, we need your help. Things are desperate at Participation House. At that point, they knew that 10 of the 42 residents at Participation House were infected with COVID. About 90% of the staff had left for a variety of reasons. And this is a group of people that live in this house who are highly vulnerable. They have a variety of physical and developmental and intellectual disabilities. They are dependent upon other people to feed them, dress them, clothe them, bathe them, lift them from their bed to their wheelchair. And in the end, 95% of the people living in that home developed COVID, and they were in dire need of help. So I got myself down there Easter Sunday morning, and I've been there almost every day since. It's been an extraordinary experience. It's been heartbreaking. Very tragically, 6 of the 40 residents have died. These are people that, because of their underlying disability, are more susceptible than the average person, because many of them have lung disease and heart disease and other issues. And we had some very desperate days. I'm happy to say that things are getting better, but it was quite an experience to be part of this.
Yeah, I can only imagine. People that have no idea why this is happening, why their routines have been disrupted, and why their roommates and colleagues are getting sick. Yeah, it must be very difficult. Well, that's God's work. Thank you for doing that. Can I ask you some questions? Since you were the health minister for a few years and you were part of the government for 4 years, essentially, how well prepared was Canada for this pandemic? We know that, there have been previous incidents, SARS, H1N1. We know that there have been reports that told us what to do to get ready. Doesn't feel like Canada was particularly ready. What do you know about that?
Well, I'm not sure that there's any country in the world that could say they were as ready as they could have been for a pandemic like this. There certainly have been volumes worth of documents over the years, both in Canada and internationally, talking about the coming plague. This has been predicted by many experts. I participated as health minister in international panels where we talked about what had to be done to prepare for the possibility of a pandemic like this. And we would do tabletop exercises and plan out what it would look like and have theoretical discussions about the reality. But I think Canada, like many, many countries around the world, simply hasn't put the kind of focus on public health that it ought to have, and hindsight is beautifully clear. But we've had thankfully a public health agency since SARS that was put together. That was one of the strong and good recommendations of the Naylor panel after SARS that was followed through on. But I think it's safe to say that the Public Health Agency of Canada has not been deeply funded nor deeply focused upon. And there are some things within its structure that have made it difficult for it to function as well as one might like. We don't have strong public health legislation in Canada, so that has put us at a disadvantage around the collection of data, the compelling of regional health units and provincial health units to be able to quickly gather the kind of data we need to be able to see where this virus is going. So there are an endless list of things that we will, in retrospect, look back on and say we could have done this or that better. I hope going forward that this will have taught us many lessons, not only about the funding and support and strengthening of public health, but also about those who have suffered most. And, we talked about the Participation House where I worked, but that across Canada, about 2/3 of those who have died in care facilities, usually long-term care. And that, I think, is the biggest lesson that we need to learn as this country. We have left behind our most vulnerable citizens. There is an extraordinary amount of work that needs to be done to make changes, to have, I believe, national standards for how those places ought to be run. And we could have prevented a tremendous amount of death if we had better focus on our most vulnerable citizens.
So let's move right to that, because we've been talking about that a lot on this podcast, because, you know, it is an unbelievable both tragedy and I think scandal what's happening in those homes. So you and I could probably agree that the private sector model for ownership is not a good one for long-term care. You and I could probably agree that those homes have been under-resourced for years and years in terms of the personnel that are working, the number of personnel that are working there, the equipment that the people have that work there, the resources into those homes generally. We could probably all agree that that model has been broken for 20, 25 years and is horrible. And I'm interested in talking about how that model ought to be different. But what I'm really interested in at this exact moment is in November and December, when people first started to sit around in rooms and anticipate the coming of this virus, what could and should have been done differently about the long-term care homes, and why wasn't it?
Well, I think we still don't have obviously all the information that we need to be able to see where things went right and where things went wrong. But there is some early evidence that's out there. So I'm proud to say that, as I said, I'm going to be going to Kingston in July to be working at Queen's University. Looking at what's happened in the Kingston, Ontario region is really, I think, quite interesting. As of last I checked, they have 0 cases of COVID in hospital, even though there have been hundreds in the community. They have had 0 outbreaks. Now, keep in mind, this is an area that there are 7 federal correctional institutes in the Kingston area, 0 outbreaks. They have long-term care facilities, the same kind that we have all across the country, 0 outbreaks in long-term care. They have really had an extraordinary response. Now, one might say that they have had some benefits around geography and timing as to having a bit more chance to prepare before the virus got to their area. But I'd like to really examine in detail what went on there. They do have a really exceptional gentleman who is the head of the Regional Public Health Unit. His name is Kieran Moore. And the stories that I have heard so far describe the work that was done within their Regional Public Health Unit to take people in public health out of areas where they weren't necessarily needing to be used, in examining restaurants, for example, or in teaching in the high schools, and redeploy those public health experts into the nursing homes and into the vulnerable populations to do inspections, to go back repeatedly and make sure that they had done what they were asked to do around infection prevention and control. And they have modeled to us what works. Most public health units were not able to do that, in part because they didn't have enough warning. I have learned so much in the last few weeks about how weak our regional public health units are in general. They haven't had the staffing necessary. They have quickly tried to hire on people, but many of the people they've hired on don't know how to run an infection prevention and control program in a long-term care facility. So there's been a lot of effort around rapid learning, but we could have done a lot better. And this is, the very large collective we. I'm certainly not pointing fingers anywhere, but there could have been more work to get ahead of this. We did so much work around hospitals, as you know, to make sure that beds were cleared out, elective surgeries were canceled, everybody was up and running, waiting at the door, and people weren't coming to the doors of the hospital. The virus was finding its way into these other places that were less prepared, where there were both individuals and institutions that were highly susceptible, and it was spreading and wreaking havoc while most officials were focused on the acute care facilities that are already fairly well staffed and resourced, and it really caught the system off guard.
So I know you weren't there, and I know this isn't about you, but give us some insight into how government works, because I don't really believe that people could have been caught by surprise by this. I mean, it turns out that the virus is more contagious if people are living or working in very concentrated circumstances. And it turns out that old people are more vulnerable to the virus than young people. Wouldn't these have been the starting operating hypotheses when talking about this? So I don't really believe that people were caught by surprise about the long-term care homes. So what happened in government that they got left out of the preparations?
I think it's a difference of what people know in theory and where the pressures are coming on them. So in theory, we all know that marginalized populations, people in long-term care homes, people living in shelters, people living in correctional institutes, and we've come to realize that people working in dense facilities like the meatpacking facilities, for example, are the ones who have suffered the most. They don't have much voice. They don't have anybody speaking for them at the highest levels of power. And I think that those
Bingo.
Concepts are there in theory in government, but the voices in the ears of government are the voices of big business, the voices of other levels of government, the voices of those who have power. And this is a case of who actually gets to be listened to.
I think that's bang on. Can I turn to another area of your expertise, which is Indigenous, and giving that. I mean, there's an outbreak now in the northern part of my province, in the community of La Loche, in Saskatchewan, and given that most Indigenous Canadians live, as we regularly say, without doing anything about it, in third world conditions, we should probably expect this virus to rip through reserves like it's going to rip through the developing world. Is there anything that we can do to protect our Indigenous population at this point, given their horrific medical care services that they have available to them?
Yes, thank you for raising that. It is something that we need to continue to pay extraordinary attention to. And you're absolutely right that we have not seen the worst of it yet. Many communities have been spared to date for a variety of good reasons, but the good leadership on the part of many Indigenous leaders who acted early and acted ambitiously to be able to protect themselves and their communities. La Loche is one area that has, as you say, already suffered a great deal, but we will not be able to avoid forever this virus getting into other remote communities. So my closest work at the moment is with a group called Anishinaabe Nation. This is a collective of 49 First Nations in Northern Ontario, some of the most remote communities in the country. 32 of the 49 are fly-in only. Again, leadership makes a difference. They have a Grand Chief of Anishinaabe Nation by the name of Alvin Fiddler. He's an incredibly smart man. I cannot believe how quickly he acted on this. He very early on advised chiefs to restrict travel. So there were most of those communities have from the very beginning watched who's coming in and out. They had rules around who could get on a plane in Thunder Bay and get up to those communities. They had to be screened first, and they have for the most part avoided infection getting into those communities. But they can't stay separated forever. And eventually there will be, as you say, the possibility of the virus getting in. And then there will be some serious problems because, as you said, the health facilities are, I think would be appalling to most Canadians to realize that other fellow Canadians live in a place where there's only one hospital in a geographic area the size of France, and that hospital hasn't had upgrades for 50 years. There are many people that are living in a community that only has a very basic nursing station available to them. I think this is an area where the government has been actually quite proactive, and I have to give some kudos to Mark Miller, who's the Minister for Indigenous Services. I know he's been on top of this, and he has worked alongside those leaders to do well, but it's definitely an area where there is still significant risk.
You appointed Dr. Tam, and she's come under some criticism, and I would label some of it to be just out and out racist race baiting, and other people have some questions about the World Health Organization and the way Canada has handled this. You appointed her. What were you looking for in that job and that person to fill that job, and how do you think she's done?
Well, Dr. Tam is an incredibly smart, wise leader. I think she has done an exceptionally strong job. She herself has said that every decision they made wasn't perfect. I don't think we'll see any medical officer of health in the country being able to claim perfection in this. But I was looking for somebody who would be the kind of leader that people would listen to. It's a strange scenario when you're dealing with a public health emergency where the people that should have their voices out front the most clearly are the medical officers of health, the scientists, the people with the in-depth technical knowledge. And I would say across most of the country, I think leaders have done a pretty good job at not politicizing this, because politics has no place in trying to get us out of a pandemic, and partisanship for sure has no place in that. And I'm pretty proud of Canadians that for the most part they have pulled together and not played those kinds of tricks. But you're right that Dr. Tam has come under some very nasty attacks. Some of them have been blatantly racist, and that is very disturbing. I think that she is a strong person and resilient. She is entirely focused on trying to do the best that can be done to ease the suffering and grief that will be inevitable. And I think we have a lot to thank her for.
I have a fancy new mic, which I'm just learning how to use. I have criticized her for telling us in February and March not to wear masks. Am I being unfair?
Well, you know things, we all know things now that we didn't know back in February, March. I'm sure there are all kinds of things that she will be quite honest with you and say that going back that she would have done things differently. She is as well getting guidance from experts across the country and trying to do the right thing. Public health officials try very hard not to instill fear in the public, because fear is not necessarily an emotion that helps us to be as wise as we ought to be. I suspect, you'll have a chance to ask her someday whether she wishes she had made that order earlier. But I think it's pretty hard for the rest of us to try to imply that if we were in her shoes that we would have done those things better. It's an impossible scenario. But I think overall the guidance has been strong, and we're seeing some really great leadership amongst many of the medical officers of health who have helped us to avoid the worst case scenario. Sure, there's been extraordinary, awful outcomes and tremendous loss of life. It could have been much worse, and it could still be yet.
We know that every day looking south. I mean, everything that we might say about Canada and how Canada's handled it, we are still doing dramatically better than our neighbors to the south, and presumably that's due to both our social solidarity as a country and to a reasonably functioning political system, which neither of which they have, I don't think.
it's appalling to see what's happening, and the trajectory that many states are on is unfathomable for us. We should be comparing ourselves, though, to those who are doing the very best. It's we always like to kind of pat ourselves on the back and say, yeah, we're better than those guys to our south. But let's look at who's doing the best. Let's look at, Germany, whose testing rates are, I haven't checked lately, but their testing rates are 3 or 4 times the rate per population that we are. Let's look to New Zealand, who have been spectacular. Of course, they have a few advantages being on islands, but that doesn't mean we can't use the same kinds of tools that these countries have done that have so tremendously decreased the rate of spread.
Hey, the last thing I want to ask you about COVID really is that the debate seems to be changing very rapidly from stay home, stay safe to how the hell do we get out of here and get the economy moving again and get people back to work and back to whatever they want to do. And that seems to be where all the focus is now going, is how do we reopen? And I'm asking you what you are thinking about as we take those steps toward reopening. What is preoccupying you as we take the chance of going back out into the world?
Well, like many, I'm very nervous. I'm nervous about some places in our country more than others. And, to be frank, I'm nervous about Quebec. I think Quebec has one of the most rapid timelines for reopening their economy, and they have the worst pandemic if you were to look region by region. Things could get worse for them yet. I don't know what kind of advice they're getting, but and again, they're under tremendous pressure to be able to manage things from an economic situation, but there's going to be
from whom would you think they'd be feeling pressure from, Jane?
Well, I think people get pressure, politicians get pressure from the general public. They get pressure from the people who are out of work, who want to go to their cottages, who are facing some very serious economic challenges. And yes, governments have done a good job trying to fill those gaps. But when you don't know how you're going to be able to pay your next mortgage payment, and you want to be able to open your store, that you're going to yell pretty loudly at anybody that will listen to you. So that's understandable that people are eager to be able to get things working again, but it has to be done with the utmost caution and care. There's no doubt that certain sectors can get back to work easier than others because they can put those safety precautions in place. Other parts of the economy are going to take a lot longer time. But I think what worries me the most is that there has been all kinds of guidance around what has to be in place in order for us to be able to do this safely. And I don't think we've still had the focus that we need to have on those measures. So I'm talking testing, contact tracing, isolation, etc. We need surveillance to a certain extent. Now, the whole issue around what surveillance looks like, how invasive it is challenging, but I don't think insurmountable. But even much more basic surveillance than that, how many tests are being done across the country? How easy is it to be able to access tests? You look at what other jurisdictions have done, South Korea, for example, in terms of the availability of testing. There should be mechanisms by which there can be broad and expansive testing, and we probably need to triple or quadruple the number of tests that are being done across the country. But even more important and harder to do than that is this concept of contact tracing. And as I said, remember that the experts supposedly in contact tracing are public health officials. We have underfunded, under-resourced, understaffed public health for my lifetime. And so who are the people that are actually trained to do that contact tracing? We don't have a lot of them. So I know from what I'm seeing in my local region here that they are trying to take, young graduates of public health schools and train them up quickly on doing contact tracing. They're taking medical students and researchers who are research students who are out of work and trying to train them to be contact tracers. It's not all that difficult, the specific work to do, but the system that allows us to be able to communicate with one another and be able to do that well is not a functional system yet in this country. So that, I think, is the biggest issue, because there are still going to have to be people who we are going to have to reach out to once the economy opens up and say, you have had close contact with someone who has just been determined to have COVID. You need to get back home 14 days. Don't see anybody else. If we can do that well, there are safe ways that the economy can be reopened. But that kind of tracing and isolation of people who have been in contact is absolutely essential to underpin that reopening.
Why can't we get these test kits? Are they not available? How does Germany get them?
Well, there are a variety of different kinds of test kits. We're still talking, for the most part, about the gold standard PCR kit. I would have to say there's still a little bit of a veil of mystery around where the real challenges lie. And I, like others, have been given many answers. I can't actually kind of walk into the labs myself and see, but there's no question there's human capacity to be able to do the tests, because apart from the official public health labs across the country, there are research labs and hospital labs that are in many cases starting to do this test. I can't run a PCR test. I haven't been trained in it, but I know that my son, who's a graduate student, knows how to run the test, and there are hundreds and thousands like him that know how to do it. We can get the people to do it. There are other challenges around the reagents and the actual swabs and tests themselves. I don't think we have run out, though, and so I think that has continued to be used as I think it's fair to call it an excuse. There is a worldwide possibility that we could run out, but we haven't run out yet. So let's continue to ramp up the availability of those reagents, and let's get those tests done. I'm most familiar with the scenario in Ontario. Still haven't quite hit the targets that the Premier was asking for some time ago. We should certainly have hit that target long before now, and that target is still probably not ambitious enough. But
he's affable, so everybody's cool with it.
Well, I think he's taken this extremely seriously, as he should.
Okay, I'll be nice. Especially since we're going to talk about politics now, Jane, because you are a historical figure, and perhaps not in the way you intended when you went into politics. I consider you an historical figure because you're the most important person to resign from cabinet on a point of principle, easily since John Turner, and perhaps ever. I just want to explore that a little bit with you. And I'll just start by being honest, which is I have regularly sort of lightheartedly said that I've never seen anybody resign from cabinet because they were unhappy about their friend's treatment. And I say that quite seriously in the sense that my observations over the years have been that people want to be in those jobs so badly that there's no end to the amount of shit that they're prepared to eat to keep the job. There's no end to the amount of compromises that they're prepared to make to keep those jobs. And certainly my observation when Paul Martin got kicked out of the cabinet by Jean Chrétien was that there were no friends lining up to walk out the door with him as a support mechanism. So you are very, very unique in that. And can you perhaps start by telling me what it was about. Well, first of all, we're in the middle of a pandemic, and you were the leading health expert in the government. Do you regret not being in the job at this point in time?
I feel like the sands of time are things that you can't control their flow of. I think that it would have been a privilege to be able to serve in that capacity during the pandemic. Nothing could be as meaningful as what I've done the last 3 weeks, which is to sit by the side of people that society has, to a certain extent, abandoned, and to try to keep those people alive. They mean more to me than any powerful cabinet job. So I think I'm where I need to be right now. And the work that I'm going to be able to do at Queen's is going to allow me to be able to have access to systemic change and impact on health policy in a way that's probably comparably significant to the policy and systemic impact that a person can have in cabinet.
That can't be true. That can't be true, Jane. There's just nothing outside of government that you can do that is as impactful as what you can do in government on these policy matters.
I don't know. I mean, I, like many others, was inspired to get into politics because of, people like Paul Martin saying to me, once you get yourself that seat at the cabinet table, you can make more difference in 10 minutes than you can in 10 years in any other job. And I would say I sure saw that on certain examples. And I'm really proud about the things that we collectively as a government were able to do, decisions we made around things like supervised consumption sites. I know that saved lives. That's why I went into government. I went into government to improve health systems, to make the world more fair. I'm perhaps trying to rationalize things to myself, but I'm not so sure that being a dean of a school of both the director of the School of Medicine and the dean of health sciences, where I will be able to have an influence over the education of literally thousands of doctors, nurses, physiotherapists, and occupational therapists, many of whom that may themselves go on into roles like politics, where they, I hope that amongst those students, I will be having influence on a future health minister. I want to make sure that they are raised up to be the best health professionals that they can be, who will have an influence on public policy. So it's a different way to have an impact. Things are how they are. I'm really happy to be doing something that I think is going to give me a chance to make, as I say, making the world more fair is what I want to do.
Yeah, I didn't mean to diminish your job at all. It's a very significant job in the country. I guess the question that I was really trying to drill to you was, and again, I'm not diminishing the people I refer to, because they're the same as everybody else has ever been, in terms of, I say people cling to these jobs, and the internal justification is that, the prime minister may be an asshole, and I'm not talking about this prime minister, I'm talking about in general terms, the minister may say the prime minister is an asshole, but I need to do this job, I'm important in this job, I've got some important work coming up. Do you have a different relationship with power than most people that go into politics do? Why were you able to walk away from the amount of power you had?
One of the things that I wrote probably a couple of years before the 2015 election, when I was deciding to get a nomination to run, I wrote the words that a seat in the House of Commons is not the target, it's the tool. It's the tool that I hope to be able to use to make my community better and to make my country better. So getting that seat of power was never what politics was all about for me. It's an extraordinary privilege to be there, and you can get a heck of a lot of good things done. But I went into politics because I felt I had bumped up against the limits of what I could do as a family doctor to make the system better, and I needed a bigger tool in my hand. And that tool was to get into government and to be able to make those changes. But when I was in that position and I ran up against a circumstance where the only way forward, and I really don't want to rehash the whole resignation thing, but I couldn't be in solidarity with a particular issue that was going on because I felt it was wrong, and I also couldn't lie, essentially, which is what I would have had to go out to media and say everything's okay. And I couldn't say everything's okay because I didn't believe everything was okay. And that sat so uncomfortably on my conscience that I ultimately felt I had no choice. It was the hardest decision of my life because, again, it meant that I would have to put down a certain set of tools. But I believed that if I followed my conscience and did what I believed to be right, that somehow there would be other tools that I would find to be able to use to achieve my goals of trying to improve lives.
So other people in politics justify doing what you refused to do on an ends justify means basis. That on balance, it is important that we be in government because we are on balance better than the other people. And on balance, it's important that I be in government because I am on balance better than the other people. I am going to presume for the purposes of this question, and it may be wrong, that you are generally, despite your personal differences, you're generally more comfortable with this government than you would be with a Conservative government in office, and that this government is broadly in line with what it should have been expected to be based on its campaigning in 2015. And so the vast majority of people in your circumstances would have said this act of deception is a small price to pay for keeping the barbarians out of office.
So a couple things I would say to that. One is that I said repeatedly at the time that I was still fully supportive of the broad mandate of the government. That I didn't feel like I could stay in cabinet because I took my obligations to solidarity very seriously. But I think that members of Parliament have an obligation to of course, work along with their other members of their party, but they also have a constitutional obligation to hold the government to account. So if you're an MP, even if you're with the same party as the executive branch of the government, and you disagree with something, you have an obligation on behalf of your constituents to speak up about that. So, and some MPs have done that. We all look at the likes of Nathan Erskine-Smith and others who have said, on this particular matter, I disagree, but I support the broad measures of this government. And I want to continue to serve as an MP under this banner. That's what I hope to be able to do, to say this is one area where I can't support it, so I can't be in cabinet, but I'm happy to serve, and you're absolutely right, to support the Liberal government as an MP. That didn't work out, but that's, it was, I'm blanking on where I wanted to go next. But you know what, I guess, yes, I would say from the last thing I said to the Prime Minister when he kicked me out of caucus was, I wish you the very best. I really want you to succeed. I want you to do well. I had no ill wishes toward the government. I just simply, the issue of the independence of the prosecution was something that was really important to me. I spent a decade of my life living in Niger Republic. I know what it's like to live in a country where politicians call up the judges, call up the police, and tell them what to do. And I think that had a big influence on me that is perhaps misunderstood, that I had seen the worst of what happens when the executive branch messes with the judicial branch of government. And you get that wrong, and pretty soon your democracy's not doing so well.
Reading between all the lines of everything that I observed about that, it seemed to me like the Prime Minister was perhaps a little absent from his relationships with his ministers and delegated that a bit too much. Would that be a fair comment to say? Should the Prime Minister have been, at least I guess you don't know what the situation is now, but should he have been more involved working directly with his ministers so that these kinds of things didn't happen?
Well, I think every leader, every Prime Minister has a different leadership style in terms of, how much they spend time with the people who are in cabinet. I would say, as a general principle, from what I've studied, and you guys are the experts on this, but over the years, I think prime ministers that have had good, strong relationships and regular, open, honest, authentic communication with not just their ministers, but with their MPs as well, it has served them well. And, I have no doubt that the current Prime Minister's style has evolved over time. But I do think any leader is, as good as they actually understand what's going on the ground. And the more that they can listen to a broad range of voices, generally the better they will be able to make wise decisions.
Thanks. That sounds great. And I won't put you through any more torture on the past. But thank you for your candor about all that. I do want to ask you, though, about your future. And so what are the things, I'm going to wrap two questions together, which is, A, what are the issues you intend to be involved in going forward? Obviously healthcare, because your profession, but you remain a public figure. And secondly, what do you think that COVID has revealed about our society that we should prioritize as fixing?
So let me start with the first one. I am super excited about my new job that I don't start till July 1st, but really, really excited about it. I mean, wow, it's to be able to have, as I say, an impact and an influence over those amazing young minds who are going to be the doctors and nurses and physiotherapists and occupational therapists of the future in Canada is just a massive privilege. To be able to make sure that they have all of the clinical skills that they need to have to do those jobs well, but also all of the other competencies that it takes to be a great healthcare professional. And, I know very strongly that helping keep people be healthy is a lot more than just the biomedicine. It's the making sure that people have decent work and that they have a decent house to live in and an education. And so trying to make sure that we continue to educate young health professionals to have a broad perspective of what health and wellness is, both for individuals and for society. That really excites me to be able to do that. So I will, bring to that job the things that matter to me most, and what some of those are. Indigenous health, particularly based on my time in government, is a huge passion of mine. Trying to raise up an entire Indigenous health workforce is something that I dream of being able to use the time at Queen's to be able to do. And focus on things like public health and population health that have come to the fore from this pandemic. But to go then to your second question, what have we as a society learned? Those are the kind of lessons that I will hopefully help be able to apply. We've learned that we have to look out for one another, that we can't just have a health system that's focused on individual health, but we have to actually look at population health, because we realize how dependent we are on one another. And this pandemic has made that very, very clear. But it's also exposed the fault lines in society, and those fault lines lie along the areas like vulnerable seniors, people in shelters, and homeless individuals. And we have to really look at where our lens is in terms of public policy, and investments and care. And if we do not improve the conditions for living for seniors, then we will need to be ashamed of ourselves in the future if we can't figure out how to do better on that.
Preach, sister. I'm telling you, it's a disgrace. And it has been for a long time. Danielle Martin was on this show a couple of weeks ago, and she said that she'd written a whole book on ways to improve the healthcare system. But after having been through this pandemic, she said guaranteed annual income has clearly risen to the top of her list of healthcare initiatives that we need to do in this country. Do you have a thought on that?
Well, I don't know that we have ever seen as many people talking about guaranteed annual income as we have in the last 3 months. And, obviously some of the economic initiatives that various orders of government have put in place get us awfully close to what would be a guaranteed annual income. I'm kind of the mind that it would have been an awesome time to be able to use a tool like that. I recognize that there are pros and cons to the use of that as an economic stimulus response for people who are out of work. Many have argued, though, that it's perhaps one of the most simple to initiate and effective in terms of its achieving its policy goals. So it would from a health point of view, be unquestionably one of the best things that we could have done and maybe still will do yet.
And how does it help health? How does it help? Like, why is it a health initiative? I understand it's an economic initiative. Why is it a health initiative?
Because the one single medicine that would do more than any other to actually make the poorest people in this country healthy is to give them money. It's really hard to be healthy. First of all, if you don't have a home, it's almost impossible to care for your chronic diseases if you don't have a regular place to lay your head at night. And I've certainly seen, not just in the poorest of the poor, but in many, many families who struggle to make ends meet, the lack of dependable income means that they can't enjoy the habits that you and I can enjoy that keep us healthy. Eating healthy food is a heck of a lot more expensive than eating crap food. And when you're stuck with a limited amount of money and a hungry family to feed, you're not going to be able to have the privilege of making good choices. So I could point to a whole bunch of experts across the country that spend their whole lives doing the analysis on this. But a basic income will keep those most vulnerable citizens healthy in a way that no other medicine could ever do. And it actually benefits all of us because that basic income is not getting tucked away in any old bank account here or offshore. That basic income is rolling right back into the economy, into the store owners, into the landlords. It is money that is going to continue to generate. It will keep people healthy and it will keep society whole.
But if you give people a subsistence level of income, they won't work, eh?
That is absolutely not true. That has been... The one thing I have learned, I spend a lot of time listening to a lot of people, thousands and thousands of them, one-on-one behind closed doors in a family doctor's office. And what people want more than survival is meaning in life. And there is something about the human condition that each of us want to know that we have a purpose in being here. And whether that purpose is keeping a long-term care home clean and sweeping those floors, or whether it's, being the nurse, people want to do a job and they want to do a job well, and they want to have the self-respect to be able to show up somewhere and know that someone's counting on them. There are a few people who can't do that in society, but the vast majority of people, given the chance to do something that would support others and make their life worthwhile, will absolutely choose that, and the evidence bears that out.
100%. Jane, Dr. Philpott, there's a lot of meaning to your life. I can't tell you how grateful I am for you coming on this show and sharing your thoughts with us and the people who listen. And let me say to you that I really hope you run again under a banner so you can get elected. Nobody gets elected as independents. Don't take it personally, please. Don't take it personally. Okay. But get back into government. We need you. Thank you.
Thanks for having me. I enjoyed the conversation.
If we've learned anything over the past few weeks, it's that in times of crisis, governments matter. So if you've never heard of Queen's Park Today, it's one of Ontario's most trusted news sources for political insiders and for people who actually need to know what is happening at the legislature every day. Whether it affects your business, your stakeholders, or the health and safety of your family, Queen's Park Today is tracking the ongoing developments in Ontario. The newsletter lands in your inbox first thing every morning so you can start your day off already ahead of the game. During a crisis, the importance of governments increases dramatically, and the only way to get the really detailed boots-on-the-ground coverage you need is by subscribing to Queen's Park Today. There's also BC Today and Alberta Today, which are great for people who want to know what's going on out west, but don't have the time to follow it closely. To get a free 2-week trial of Queen's Park Today, BC Today, or Alberta Today, go to politicstoday.news and hit the free trial button. That's politicstoday.news/free trial. All right, folks, we're back on the Herle Burly with our ever popular political panel of Scott Reid and Jenni Byrne. Hello, folks. How are you?
Hello.
Hey-ho. I'm not great. You know what I did? You know what I did last night?
No. I didn't even want to know.
No, it's not quite like that. I ordered clippers. I went online. I spoke to a friend who cuts hair for a living. I said, "What do I get?" She said, "Don't get the cord ones. Don't get the cordless ones." And I got more fucking hair than June Carter Cash, and I'm sick of it. I'm getting rid of it.
Well, good luck.
Really?
Yeah.
You are going to be one ugly motherfucker when this is over.
More face, less gray. Not going to be pretty.
Having said the word motherfucker, I just want to start. I got a couple things off the top here that I want to say. The first thing is that today would have been my mother's 101st birthday. Jenni and Scott, you both lost a parent. You know, I'm thinking about her every day, but I thought today I would mention her. May 5th, my mom's birthday. Second thing is, I got a little wrinkle for the show here because people are quarantined, they're bored, they're looking for things to do. I'm going to introduce a great book about Canadian politics every podcast. And here's my one for today, Contenders, written by a journalist named Patrick Martin, Alan Gregg, who was the conservative pollster, and George Perlin, a political scientist, about the 1983 conservative leadership race. It was the most exciting leadership race I've ever witnessed, and this is a fantastic insider account of how it went down. If you're bored and looking for something to read, find a copy of Contenders somewhere.
It's a great book.
All right, and the last thing...
George Perlin was my prophet queen. George Perlin was my prophet queens. Alan Gregg is a buddy. Wasn't when the book came out, but it is a great freaking read.
Yeah, it really is. Last thing, people. Hey, look what we've got. TELUS, our friends at TELUS sent us all special fancy microphones. Hopefully we're sounding better. We won't expose you to all the jokes Reid told about these things when we first got them.
I call it lick, as in phallic.
Anyway, thank you, TELUS. This was a fun gift to receive, and I feel like a real professional. All right, let's start off with the interview that I just did with Jane Philpott, which I thought was really fascinating. She seemed to think that a number of the things that had gone on in Canada, like the lack of testing and the issue in long-term care homes, were avoidable, and she kind of didn't have an explanation as to why we hadn't gotten those things right. And I thought that on long-term care, Scott, she was effectively saying what you were saying, which is the squeaky wheel. You said last week hospitals are within people's domains, so they focused on hospitals. And she was saying, nobody was talking about long-term care in those meetings.
Yeah, I thought her answer I mean, it may be a pinch demoralizing, but I thought that it was highly reliable. Like, it struck me as extremely truthful, understandable even. Just that, look, you know, that's priority voices that command attention around the cabinet table are not those that would be highlighting this challenge necessarily. Right. And so that's thing number one. Thing number two, everything's an apprehended crisis. Everything in government is an apprehended crisis. Every briefing note talks about an apprehended crisis. There is always a need. And so people very rarely in government respond to the apprehended crisis. They almost inevitably await the actual crisis. And so I thought her answer was interesting and more thoughtful than anything I could say. But, you know, it's how do you justify the expenditure of huge sums of money for something that might happen, as opposed to huge sums of money for the problems that are happening? That's the test of cabinet day in, day out when you're working in government.
Jenni, what do you think?
No, I thought it was very interesting. I think she definitely hit the nail on the head. The thing, though, about long-term care, and not to go away from the interview into like today's topic, is that this no longer is a surprise to anyone. We have been talking about what has been going on in long-term care facilities for the last 2 months, since we've been basically self-isolating. And it was April 15th that the Ontario government shut down long-term care facilities for visitors and stopped the flow of staff between homes. Nova Scotia is seeing a hit as well, as the same as Quebec. They have a long-term care facility in Halifax that's lost 32 people over the last couple of weeks. So this has now become, this isn't a surprise to governments. And what is surprising me is that no governments at any level seem to really be able to get a handle on this. And be able to be able to contain this or stop the spread of this within long-term care homes. So it's to me, it's no longer a surprise, as she was talking about. It was a surprise in February. It no longer is now to governments.
No, it can't be a surprise, and I still don't know that they've put the right resources in there. I don't know that it's still as much of a priority as it ought to be, but I'm getting out of my depth on this. It's just so frustrating, so frustrating to watch.
It is frustrating. And I think that we're not even fully getting answers from governments as to how profound the problem is. And so now you have the daily, the briefings that talk about how many, and they'll say, you know, deaths in long-term care facilities, deaths in hospitals. It's absolutely horrible. And I'm like that they're doing this, saying this, but we might have touched on it last week, that you have residents from long-term care facilities going into hospitals, and if they pass away in hospitals, the government's not being clear as to whether those are being counted as hospital deaths or long-term care deaths. So I actually think the travesty that is happening in long-term care facilities is actually even worse than what our governments are letting on to us.
I'll tell you, I may not be feeling safer about COVID, but I am feeling safer. I'm feeling safer because the Government of Canada has finally removed the scourge of assault weapons from our streets and banned all kinds of nasty guns.
Wait, Dave. This is your podcast, but seriously, we're gonna. That's it. We're not gonna talk about Jane Philpott's comments on walking away from cabinet. We're done with Jane?
Go. What do you want to say about it?
Well, I'm fascinated by her. First of all, I thought your question, I'm sorry, but I think it was a startling exchange when you said to her, what about you makes it possible for you to walk away from power when so many others have not, and when so many others chose not? And I thought it was a fascinating exchange, because her answer basically was, well, in order to keep my job, I would have had to go out and say everything's fine, and that would have been a lie, and I just couldn't square myself to it. And I remember when that was going down. I have two contradictory thoughts about this. I really want to hear what you guys think. Because when this was going down, I remember Neil MacDonald called me, and he was writing a piece. And his piece basically, it was a little bit like your question, right? His piece was, there must be a plot. No one does this. There aren't these two resignations. There isn't. This is a play against the king. This can only mean that there is an effort, that Philpott has in her mind that she will become leader, that they're going to take Trudeau down. Like there's an orchestrated play here. And I kept saying, I don't know, maybe. And he's like, Reid, you're the guy that's like, grizzled veteran of leadership wars. Like there must have been a play here. And I think the premise of your question was kind of like that, in the sense that it's like, if people like us find it inconceivable that she would step away, I think it's really hard to contemplate. But then I had this other reaction when I hear her say, well, I wasn't prepared to say what I felt was a lie. I shake my head because I can't imagine that those are their only options. Like, why couldn't she have walked out of that cabinet room and said, no, things are not okay. I'm really upset about the way things are. I don't think a lot of people are thrilled about the way things are, but it doesn't extend to the point in which I'm going to walk away from government. I'm not going to resign my seat. I don't have to like every single thing I see in order to be part of a government. So I just don't know that I accept that those are the only options available to her. And so I struggle with that. I'm not accusing her of malice.
You've just articulated, that position that you've just articulated is the position that she took to try to remain in caucus. And it wasn't a good enough position for her to actually stay in caucus over. So I don't imagine she'd have been allowed to stay in cabinet with that position. She wasn't even allowed to stay in the caucus with that position.
Context is everything. That was after she'd resigned from cabinet, and it was seen as an explosive shot against the government. If she had come out of a cabinet room and said, I'm not cool with everything, but I'm not going to walk, and I'm going to try to work hard and get us and help get through this, I'm not convinced that it was the only option. And I really don't believe, and we've all worked in these positions, I don't actually believe that there was some unelected snot, like one of us, standing over her saying, if you don't stand up and say that everything is great, we're going to cut your head off. I think she may have perceived that to be the case. I can't imagine that it was actually the case. And I don't think they would have forced her to resign. I don't think I would have forced her to resign or recommended that she be forced to resign if I'd been in the Prime Minister's office. If she'd just come out and said, sorry, I'm not cool with the way things are going, but I'm not going to blow the ship up. And so I struggle with that.
Well, I thought when all of this went down, it struck me that she was incredibly naive. Someone that was involved in politics and really didn't kind of understand how the game was played. But she compared the Liberals' handling of this to living in the Republic of Niger for 10 years. Like that's how strongly she felt about it. She was talking about, she did. I'm not, she did. She said it. And so she was talking about, when the executive branch messes with the judicial branch. So this was obviously something that she felt extremely personally strong about. She obviously is a very good friend to Jody Wilson-Raybould. There's not a lot of we've seen these things happen in various degrees over the years, and I'm not sure I know any politician who has had a friend as good as what she was to Wilson-Raybould. Who knows if it was reversed, whether it would have been the same. But I think that I think this was obviously something she felt much stronger about than probably we probably, at least I can say for me, that I comprehended over a year ago when all this was going down.
Yeah, it was pretty direct. It was pretty direct, and I also thought she was interesting on the subject of the Prime Minister.
She doesn't strike me as either naive or malicious. I really didn't come away from that, and I'm not accusing her of either thing. I guess I am stuck on the point that I don't think she was trying to take down the Prime Minister or take down the government. I don't think she was trying to do that. But I'm not convinced she was naive either. I think that she may have been mistaken in believing that the only option available to her was to quit. I don't know. I guess
there was a tinge of regret in her voice. Wasn't there a tinge of regret in her voice?
I didn't get that.
I'm not sure.
No, I thought there was.
Maybe. I feel uncomfortable applying. I feel uncomfortable insisting that that's the case. I don't know. I don't know her, and so I wouldn't want to. I wouldn't make such an important thing, an important statement about her mindset.
You're telling me I better walk that back then.
I'm telling you, Dave, you're out of line, and as soon as those borders are open, I'm coming to Quebec, and I'm going to take you round and round.
All right, so screw my fancy introduction. Jenni,
Sorry.
you got involved in politics out of opposition to the gun registry.
Yes.
This week, we saw yet another offensive by a Liberal government against guns in our society. Many of us, including myself, are applauding this, don't see any role that those type of guns play in our society, especially when you see people in the States storming legislatures with them. But I know that you'll have a different perspective, and tell us what that is.
Well, I'm not really sure what new the Prime Minister, like what new that he announced. It seems that he's made this announcement 3 or 4 other times before in terms of banning the assault rifles. I truly support. I believe that people that hunt deserve to have their rifles. Some hunting rifles are semi-automatic. Some obviously are not. You're not going to get like a visceral defense of banning assault rifles from me, though. I have a hard time. And I know I'm going to have friends that are going to blow up my phone after they hear this that are gunnies. But I personally, you're not going to get a visceral reaction. I think that this was an announcement, a purely political announcement. I think that the Liberals have already announced this before. I think criminals do not register guns or will participate in a buyback program. And the tragedy that happened in the crime that happened in Nova Scotia would not have been prevented because the murderer did not. He was not a registered gun owner. So I think the Liberals are purely playing politics with this.
But let me say that both O'Toole and McKay have risen to the fight, and obviously they think that the membership of the Conservative Party will be strongly opposed to this because they have come out strongly opposed to it, even in the face of public opinion. Yet another instance of where they are playing to the base instead of the electorate.
Well, I think that you will have people that feel very strongly about this in the party. As I said, I have friends that own like a lot of guns. Those people care very deeply about this issue. So that's who they're playing for. And then you have people like me who believe this could become a slippery slope where, the Liberals, this is just a way for them to bring in a backdoor gun registry that really is just going to penalize deer hunters and duck hunters. This is also one of the things they talked about is also in terms of municipalities. This of course will have to go to legislation. It can't be done through an OIC, which is what they've done in terms of the announcement that they made is that they're allowing municipalities to ban handguns or ban weapons within their jurisdictions.
So let me start by saying this. I grew up in rural Ontario.
Melville boy, what's your position on gun control?
Pretty moderate, right? I mean, my view is that you don't need these weapons, and I'm alarmed about the ease with which some wanker can get on the internet and get a modification kit and turn a semi-automatic weapon into something much more fierce. But I definitely believe that hunters ought to be able to have hunting firearms. And, my family, we have a hunting camp. People practice firearm safety. So I'm not a lunatic on this issue. I'm not like a hard, anti-gunner type. And lots of people assume I am, and they accuse me of that. That being said, most of the arguments I've heard substantively on this, I find kind of hard to buy. People say stuff, well, it won't really do much. Well, I don't know. It's 1,500 categories of weapons will now be prohibited. It is probably 100,000, 105,000 they say they think. Now, I know that doesn't include a bunch of illegal weapons. We can come to that. But even if 30,000 of them get turned in, even if 30,000 get bought back, that's 30,000 weapons that can't be used by a drunk spouse on a victimized spouse. It's 30,000 weapons that can't be stolen from someone's house and then put into unlawful circles. And they now say it's 50-50 in terms of where guns are sourced, in terms of whether it's domestic or across the border. It's 30,000 fewer of these weapons out there. So I'm A-okay with that. I don't believe in the slippery slope argument. I don't think that anyone's going to try to take away a hunter's rifle or a farmer's rifle or shotgun. And when people say, well, we need to do more on smuggling, I say, sure, you bet. We need to do more on parole, maybe. But those things aren't, this move isn't rendered invalid because those other valid things aren't being done.
No, but why is this, which may be more show than reality, why is this better politics on guns than enforcing at the border? Like, why do governments keep wanting to announce this kind of thing, which gets a lot of headlines, as opposed to really going at the hard work of stamping out the illegal guns? Is it
because it's easy?
Go ahead.
Yeah,
it's because it's easy. Like a lot of the illegal guns are coming in through the Akwesasne Reserve, which of course borders the U.S. and Canada. So there is no government that has the appetite to be able to actually stop the flow of guns and other illegal and drugs and what have you at that point of reserve, because you're actually going to have to go in, and it'll be very messy, because of course the border is patrolled right now by the First Nations on both sides of the border.
I'm not sure it's an either or. I know it's not, and we all know it's not an either or decision, but I also don't think the government's saying it's an either or decision. I think Blair was saying, look, when Parliament is back in full muscle, we're going to be introducing legislation, and that legislation is going to include funds for smuggling, and there's going to be further announcements about that. I'd be astonished if Bill Blair, a former cop, wouldn't feel strongly about that. But, obviously, when you got pictures of like these whack jobs in the Michigan legislature with masks on, going full purge and these weapons, there's a resonance to saying, not fucking here, not here. And people I know say, well, Nova Scotia was at the timing, and is the timing of this all politics? Because it seems like an asymmetrical announcement. Like it is discordant with everything else. There's not been an announcement about any government initiative other than COVID for the past 2.5 months, and suddenly this. I actually wonder if partly the political timing is more motivated by the resumption and the confirmation of the Conservative leadership race, and the notion of, come on, fellas, take the catnip. And they took the catnip. And I think that just to me, I know it's hard in the middle of a leadership race not to play to the most narrow base, but good grief, man, this is a position. It's an 80-20 thing in terms of public opinion, and you don't want to be captured in any way that feels permanent on the wrong side of that divide. So I'd be pretty careful if I were O'Toole or McKay digging in heavy on this issue.
Well, listen, to your point, I think most people are just paying attention to COVID-related issues, and it's going to eventually go from health to the economy. But Leger put out a poll this morning, and right now nationally, the Libs are sitting at 44%, Conservatives 25%, NDP at 15%.
Boy, gotta widen that. Gotta widen that appeal.
Well, I assume that was. I assume that poll is dated now, and that the Conservatives will have improved their position substantially since Andrew Scheer yesterday advocated starting to phase out the CERB before people have even started to receive the fucking thing. And what the hell? Ghost of leaders past. We talk about this every week, but this was, Scott, you tweeted about this. This was a particularly bizarre intervention at this stage of the discussion to stand up and talk about the moral hazard associated with the income subsidy and the need to start phasing it out so people would have some incentive to work. I mean, surely everybody that's on that thing must think he's the biggest ass in the world.
I would think. And so, you can come at it two ways, from a policy perspective or for a pure politics perspective. I don't understand either. I mean, I can argue about the policy imperatives for a long time. Eventually, of course, we have to withdraw the CERB. And yeah, you always want to ensure that the moral hazard is addressed. I don't think that there's any evidence whatsoever that incomes are resuming and that pay slips are resuming in a substantial way. People are rehiring, and therefore it's unnecessary, and we need to start graduating it out. Nor do I think there's any evidence that people are actually sitting around blowing soap bubbles in the air and drinking beer all day long. It's just not happening. So there's all that. But why? And I know, Jenni, you've talked about this. I don't mean to put the onus on you, but Jesus H. Christ, the guy is a caretaker, interim leader who's been driven out. He's there simply by the mercy and good grace of his caucus that doesn't want to spill his blood publicly. And he goes out and announces a policy that appears to be a forward-looking policy. What is his authority to do that? If I was in caucus, I'd say, shut your fucking hole. You who've lived off of the public dole your entire life since your early 20s. What are you doing? Shut up, go away.
Yeah, I'm not disagreeing with you. The onus, as I think we said last week, the onus is on caucus to say that. I think the plus side, I guess, for the Conservatives is no one is paying attention to Andrew Scheer at this point. But to the point, in terms of policy, the government is going to have to start thinking about how they're going to transition this debate, or transition the topic of what we're going through now into the economy right now. And I know we're going to get into it with we're going to talk about Alberta later, but Alberta is seemingly the only province, followed by Quebec, that has started to transition into, okay, what does this mean for the economy? We actually have to start thinking. And so, we said this before, the CERB benefit, when the Prime Minister announced it was going to be a 3-month program, but actually in legislation, it's actually in legislation till the end of October. So it's only a matter of time before the Liberals come out and announce that, people receiving the CERB and who have not gone back to work, they'll be fine until the end of October. But right now, the government has to start figuring out how that transition is going to, as we transition into what are we going to do about the economy?
Yeah, I'm sure that's right, Jenny. I'm sure that's right. But when you do that, surely the worst way politically to frame it is to question the work ethic of the people that had to receive it.
Yeah, I'm not disagreeing with that.
I think it raises an interesting question for Conservatives that Sean Speer and Ken Busenkol, I've seen them say this. I think this quote or this thought belongs to Sean, and that is that Conservatives have to think about what are new conservative ideas to deal with current and future economic conditions. So it can't just be fiscal hawks. That feels like that was a remedy for another time. So what are conservative ideas to deal with the economy in the looming time that meet the test of being conservative, that differ from the government, and that ideally, because everybody wants to get elected, have some public appeal and resonance. And I think that's going to be really interesting. Like, how does the government itself, how does this Liberal government manage the transition, whether it's the next 2 months or whether it's the next 12 months? How do they manage the transition as we start to pull some of these supports back? But then what are the Conservative proposals as alternatives that don't appear as though they're motivated by kind of smallness and narrowness of spirit, because I don't think there'll be a lot of tolerance for that. So you got to find an idea that contrasts, but doesn't feel like it's ill motivated from a matter of values. And I think that's going to be interesting to watch.
Yeah, I think that's what a lot of people are going to be watching for leading in as the leadership race ramps up. And it seems that right now, August 21st is the date that the new leader will be selected, that people are going to be looking at in terms of what ideals the candidates bring to the table.
But neither of those guys have given us a hint of anything even close to that in any substantive terms. It's just social media, finger pointing, scapegoating, horseshit, blow themselves up, take it back the next day. Like, we haven't seen any of those kinds of things.
Well, and
I think there must be a huge appetite in the party.
It's a small ball game right now, for sure.
Well, the race was pretty much suspended up until now. So we're going to see what the next 3.5 months brings. But I think these candidates, they're going to have to come to the table with some economic policies, because whether we like it or not, and whether it's in 6 months or a year or 2 years, there is probably going to be a problem in this country in terms of debt, and I'm not saying we're going to be immune to it. It's going to be like we're going to be alone on this. It's every other countries in the world are going to have to deal with this, but these are going to end up becoming the questions if we have massive amounts, if we're sitting with a $1 trillion debt on top of a $300 billion deficit. This
well,
will
Sean
become
Speer, Scott, who you mentioned, and was, I gather, Jenny, a very significant advisor to Prime Minister Harper, has co-authored a piece with Robert Asselin about the need for a industrial policy in Canada, which is a really interesting idea from a Conservative, because the last time we heard those words was from Brian Mulroney in the mid-'80s, when basically declared an end to Canadian industrial policy and said that the market was now our industrial policy, and we haven't really had one. It's actually been kind of verboten to mention the phrase in the last 30 years in Canadian politics.
For Liberals also. I mean, the neoliberal philosophy championed by conservative leaders like Thatcher, Reagan, picked up and echoed by Mulroney, it made it for a generation. It made that kind of macroeconomic planning just off limits. So it is interesting to hear from Sean. But I think that's the kind of thing that conservatives are going to have to play. They're going to have to say, look, that was then, this is now, and we're going to have to come up with something that's conservative but contemporary. And I don't hear it from, Godspeed to Sean Speer, but it doesn't feel like it's coming from the candidates, at least so far.
Jenni, you've got a new business that is aimed at advancing women in leadership roles in business and other places in Canada. And we have this week seen some startling statistics about the impact of this economic downturn that maybe we should have suspected based on what we were observing, but the starkness of it, every previous recession in Canada has hit male employees harder than female employees, in that it's wiped out construction, it's wiped out the kind of manual labor jobs that men tend to do. And we have therefore responded to those recessions with infrastructure programs, public works programs to put men back to work. In this recession, the job losses are overwhelmingly female, and not in construction or projects like that, but in the service sector, which requires an entirely different type of economic response and stimulus to get women back to work. Do you think that is going to be taken into account in both federal and provincial government policy? I mean, we still continue to hear people use terms like shovel ready, but increasingly economists like Mike Moffat and others are encouraging us to think differently about this.
Yeah, I think that the stimulus that the government's doing, and I think we've talked about this before, is going to be completely different than what 2008, 2009 was. To your point, it is going to be less about construction and physically building stuff from not only just like developments, but snowmobile trails and all of that stuff that went under stimulus. And I think that to your point, women are overrepresented in the service industry, and that is going to be, I think, whether it's whether you're looking at it from a male female perspective, governments are going to have to look at these sectors in terms of what they do for stimulus, because in some cases, unlike the last recession 10 years ago, some of these businesses aren't coming back. And we've talked about this. You've got, restaurants that are going to start opening at 50% capacity. Well, not here. There's nothing been announced in Ontario, but in other provinces where they're actually talking about letting people get out of their homes. You're talking about restaurants at 50% capacity. There's some restaurants that will just never be able to recover from that. And you've got small restaurants in Toronto and other urban centers that only fit 20 people. So what are they allowed to have one table for when they open up? So these are in terms of like restaurants and tourism and everything from sporting events, like what is it going to cause in Toronto for the economy when there's no Raptors or Leafs or Blue Jays or TFC? So I think these are the factors that governments that we didn't have to look at during the last recession.
Scott, I don't know, some of our friends, Andrew Bevan and others, are really pushing the idea that we need to that the response to this is to invest a lot of money into care, the traditional areas of female employment, but also particularly childcare, because it's going to be very difficult for women to get back into the workforce, especially with schools only operating erratically without adequate childcare. Do you think we're going to have a female-focused kind of recovery policy?
I think we will. I think we will see from this federal government. I think we will see an emphasis on that. The question is, how strongly are they willing to lever that policy direction with the provinces by using the checkbook as a way to sort of fishing pole lure provinces toward policy adoption in the way that they like. We haven't seen this government do that very much. Paul Martin did. on healthcare. He said, we're going to make a trade. And it was messy and we had big, long arguments and all that. But we got wait times agreements in exchange for more money, and people complained about it, some of the provinces. We've seen that approach abandoned. And I wonder if we'll see a resumption of that. And I think that's going to be a really important question. I think another important question, I think it's an important question because we've not seen Trudeau willing to do that. We haven't even seen him willing to do that during this exercise. It's been very much like on the reopening. It's very much a hands-off, step-back, federalism play. So I think it'll be interesting. If they want to make that an emphasis, that's fine. If they want to make it real, they're going to have to actually, I think to some degree, incentivize it. And that's going to come with some political arguments. Another, I think a big fundamental thing is which path, and they're not exclusive, but going forward and reopening the economy and creating incentives for economic renewal, do you place the emphasis on helping employers, or do you place it on supporting individuals and incentivizing them and giving them rewards? And that's going to be a tension that we're going to see played out, because lots of people say, and you see this in the States, they say, well, don't reward the big businesses and the rich guys, right? Like, why would we give them money? Let's, help people. And if you want a gender-oriented policy, it's going to be easier to do that if you tend to focus on individuals. You can create that. You can do it to some degree through a sectoral policy, because you can emphasize sectors where women are more predominant. But I think that's going to be a tension going forward, and we'll see. And we may see one place where public's opinion starts to deteriorate is in support of government writing big checks to big employers. They may say, hang on, are we seriously going to give a shitload of money to Bombardier? Because that's we see that as a valued high-end advanced manufacturing industry, and we hear the cries from Quebec. Or are we going to say no to that? That's politically verboten. And then if you don't, what do you do? Because just sending checks to individuals, I'm not sure is going to get us there. So I think, we're just starting to struggle with this.
If you take something like Jenny's example of the restaurant sector,
yeah.
Right? There's nothing that government can do for the restaurant sector other than make people feel safe enough to go to restaurants and make sure that people have enough money to spend at restaurants. There's nothing else you can do for the restaurant industry.
I think there may be more interesting ideas out there, particularly at the provincial level. I think there may be things they can do to help the restaurant sector be different. Like if restaurants are going to look different for at least until there's a vaccine, they're going to be more spaced out. They're going to be different. I don't know where I'm going with this, but it seems to me people will do innovative things and be more successful. No, I mean, I'm just being honest, right? I mean, I assume that somebody will come up with a better mousetrap when it comes to how to make a restaurant business that has fewer people in it, nevertheless, make more money and be successful. And so once we identify some of those strategies, shouldn't we be incentivizing those strategies?
I assume the answer to that is MLSE beer pricing.
Well, I'll tell you right now, if I can go to a bar,
charge $20 for a pint of beer, you can make money no matter with fewer people.
There is no amount of money I wouldn't pay for a glass of beer in a bar right now. I'll tell you that.
I thought the government, speaking of a female-focused economic policy, I thought the government missed an opportunity this week. In the appointment of the new Bank of Canada governor. This is no slight against the person who's taking the job, who is highly and eminently qualified and comes highly recommended. But the leading candidate and the person next in line in the bank was a woman named Carolyn Wilkins, who had been heavily involved in the financial crisis of 2008, 2009, probably worked with Jenni a little bit, and had been obviously the point person along with the current governor for the reaction to the pandemic. And Heather Schofield wrote a great piece in the Toronto Star about how this would have been an ideal time, with the recession so heavily impacting women, to put a woman in a real economic leadership role in the federal government. And I have to agree with that. I mean, this is a government that has been superb on gender issues and obviously takes female empowerment very seriously, and I'm not questioning that. But this one seems like a missed opportunity, and from what we read in the gossip sections of the paper, a missed opportunity that was driven out of insistence from the finance minister's office.
Yeah, well, it seems that way. It was a win for Marno and a win for your old buddy Mark Carney, because Macklin was his protege and was expected to be appointed in 2013. And my understanding of what went down in 2013 is the fact that he campaigned so viscerally for the position in the weeks leading up to the appointment is what turned the government, especially Minister Flaherty, off in appointing him in the first place.
Well, I definitely think it was an opportunity missed, and I have nothing. I think Tiff Macklin's probably a genius, and I don't know him, but I have lots of mutual friends, and no one has anything bad to say against the guy. So I don't want to diminish him in any way. I don't want to paint him as the boring conventional candidate. But I think that, other than Lagarde, there are no women in major decision-making roles in central banks around the world, and I would have thought that this would be a fantastic opportunity to put someone who has unquestionable credentials and expertise, and I think probably unique insight for this situation into such a role. So I think that's a missed opportunity, but I still think the big question is what's going to happen? Like, I think central banks are going to be challenged in the way they were in 2009. They had to invent new tools. I think they're going to have to invent new tools this time, because everyone's going to face these massive debts, and they're going to have to figure out how do we stretch them across jurisdictions? What do we do when everyone's massively indebted? What's the role of monetary policy in getting us forward, especially in a world where there's virtually no QE room left, because unless we go to -4 interest rates. So how is all that going to happen? And I think that's going to be super interesting to watch, and I think we routinely underestimate the significance of central banks. And so I think that'll be interesting. Last thing I'll say, Dave, you made this point. There was a Bloomberg story about how this appointment was a win for the finance minister. It sounded like it came from finance. I have no way of knowing whether that was the case. It was kind of told from the finance minister's perspective.
It read in their voice, yeah.
Yeah, so, and if that was a damn strange and stupid thing to do, because it politicized the event. It put Morneau in the position of saying, well, his idea of a win was to not have a woman secure that job. And it does no favors to Macklin. It puts him in the position of the guy who got the job over the preference of the Prime Minister's office and over the historic opportunity to appoint a woman. And I don't know why you would freight that on the guy. So I hope the Finance Minister's office didn't stitch that story together, because if they did and they thought they were doing something good, they didn't do anything good. Not for anybody involved, including Morneau.
Since the choice of the Governor of the Bank of Canada is always the choice of the Minister of Finance, Paul Martin chose Gordon Thiessen, Jim Flaherty chose Stephen Poloz, right? It's not much of a win for Morneau to claim that he got to appoint the Governor of the Bank of Canada, is it?
No, I guess in this, I don't want to delve into the psychology of it. I will, so I will take any excuse to use to pull out my old Chrétien impression. You'll remember, David, in the early 90s, we come to power, Paul's made finance minister, and Crow is the central bank governor. He was an unyielding, unbelievably officious, commanding person. And we go into a negotiation with him about inflation bans. And the position of finance and Paul Martin was, let's have a band of 1 to 3. That's our target band for inflation. Nope. No way, says Crow. Go fly a kite. Forget it. It has to be 0 to 2. And this got to the point where there was an impasse. And then finally, Paul goes to the Prime Minister. He says, I think I'm going to fire Crow. And Chrétien is like, oh, you cannot fire the central bank governor as we are going through this.
Wait a second, just to be clear, not over the 1% difference in interest rate, but over the intransigence.
Over the intransigence, right? and you talk about open campaigns, there was essentially an elite level campaign where Paul suddenly gets assaulted with one phone call after another from leading financial figures around the country saying, well, you can't, you got to back off. Like, you can't do anything with Crow. And for sure, don't let this fight escalate. You guys can't be at blows, and remember what happened to Diefenbaker and blah, 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 blah. And finally, so Paul, the Prime Minister says, all right, finally the Prime Minister says, well, it's on you then. It's on you. If you're going to do it, you're going to get rid of them, it's on you. So by coincidence, the very day that Crow was fired, there's a reception at 24 Sussex. And I walk in, and I see the Prime Minister standing there with a big crowd around him, and they're all laughing and going. And I walk over.
What kind of reception at 24 Sussex included you?
It was obviously there were 3 deep in the thank yous. It was a tertiary level of gratitude. There were no hors d'oeuvres left. I brought my own wine, and Chrétien standing there though, and he's got all these people around. He's doing the full Chrétien, which is a great thing to watch, right? I mean, the guy is wildly entertaining, and he's, how great a Prime Minister am I today? I fire the governor of the Bank of Canada, and the dollar, it go up. Ha! I am the fucking best. I tell him, I say, crow fly out. Ah. And then I'm sitting there going, wait a minute. Didn't he tell Paul not to do that? But you know what? Those are the privileges of the Prime Minister. Every drop of rain that falls in your government is your fault, and so every ray of sunshine is your blessing, I guess.
Yeah, the thing I remember about that is about what you were referring to, how all the economists and all the business leaders lined up publicly to say, you can't touch Crow, it'll destroy the confidence in the economy, you can't touch Crow, he's the best. And as soon as Paul fired Crow, all those people were like, the king is dead, long live the king. Gordon Thiessen, you rock, brother. And nobody actually liked Crow, they were just afraid of him.
Yeah, and then when Paul, remember, tales of central bank governors, people are like, wow, I think I took a wrong turn on this podcast. But when Paul wanted to appoint Dodge, right, who had been his former deputy minister, I remember Chrétien going, and on this, I was with Chrétien. He was kind of like, are you sure? Like, isn't it going to look a little cozy? You're appointing Dodge. Are you sure you want to do that? But Paul insisted on it, and I think Dodge's reputation now is firmly established. So I'd say our old boss did pretty well when it came to the picking of governors. Not to mention Mark, when Mark took over.
Last thing we've got time to touch on today, because we're running out of time, is Jason Kenney and Alberta. Now, we know that Alberta is in desperate circumstances. We know that they've got a collapse in addition to COVID, and they have the most serious COVID problem in Western Canada by far. In addition to COVID, they've got the complete collapse of oil prices. They've got flooding in the north, probably locusts in the south. I don't know what's going on, but the premier is sounding, again, increasingly agitated about where is federal support for the oil industry. There was some announced a few weeks ago in terms of the help for orphaned wells. I guess that's not considered to be an adequate response. Jenni, do you have any idea, A, what Kenney wants out of Ottawa, and second of all, what the holdup in Ottawa might be? Because it is the case that the Prime Minister and the Minister of Finance said many weeks ago that something was imminent.
Yeah, and you don't see it. It remains to be the frustration that Albertans have, that Premier Kenney has, that it seems that if people in Alberta are there's tough times, then it doesn't seem, governments don't seem to move quick, or this Liberal government doesn't seem to move quick. The fact of the matter is our number one export is oil. We need Alberta, and we need the oil sands, the oil industry to succeed. And I think that the frustration that Jason has, that his government has, is that there is no movement or discussion with the federal government. There's a lot of platitudes. Chrystia Freeland makes a lot of calls. She, of course, is a daughter of the prairies, having been born there. So she throws that out, but there's actually nothing substantive except for platitudes. And Alberta, to your point, it's not just the pandemic. It's also before this even started, getting oil prices getting caught in the fight between Saudi Arabia and Russia. And in terms of the pandemic, Jason's kind of saying, okay, we were the hardest hit in Western Canada. They would arguably have been the best province in terms of PPE. There has not been shortages in Alberta. And in fact, they have been able to send to other provinces that have been short, Ontario being one of them. So I think it's completely reasonable for for Alberta to expect the same treatment that other provinces would have for their industries if they were having the double whammy that Alberta is having right now.
Jenni, do you have any instinct as to, not instinct, do you have any idea what they're actually looking for? Because there are some comparisons drawn to 2008, 2009, but as people have pointed out, in 2008, 2009, when the auto companies were bailed out, the government, well, you designed this program, but the government took equity positions in those automobile companies. I don't think anybody is suggesting that for the oil industry. So what form might assistance to the oil industry take?
Well, I don't know. I think one thing that off the top of my head that I know the Alberta government is calling for is let us just sell our oil. Let us take away the red tape and all of the problems in getting it actually to Tidewater. It's not like Alberta is asking solely for a bailout. They're asking to be able to sell their product, which has been a problem leading.
Well, what does that mean? I mean, it's not like it's red tape. It's like, how do you ignore the Supreme Court's ruling with respect to the rights of Indigenous to be consulted, and how do you make certain, how do you get pipelines built faster? I mean, the government is building a pipeline. I'm not trying to be difficult. I'm just saying, I don't know how, if I'm in government, I go, what if I say, yes, I want to respond to that as fast as I can and as fully as I can? How do I? Well,
there has been no evidence that the government, we were talking about blockades before we were, before pandemics, when we were in Ottawa. I think that's, the second last time we were in person doing this, and there really wasn't. The government was not moving quickly in terms of stopping those blockades. In terms of that, so I think that what Albertans are going to be looking at is more of a that basically the federal government is actually hearing them and is going to do something and not just give platitudes, which is what they've been doing. Because for Canada to survive economically, because part of the reason that helped us in 08, 09 was Alberta, oil is our number one export. If we do not have, if Alberta does not have that industry, it is actually, the ramifications are going to be huge across the country.
I guess
Jenni, Jenni, one of the common themes of our conversation today, from long-term care homes on out, is that if you're not at the table being a squeaky wheel and agitating for your issue, right, government's unlikely to respond to you. Is a big part of the problem here that Alberta has nobody at the table?
Oh, I'm sure it doesn't. It may not. It may not. Actually, with this government, I don't think so. I just don't think the appetite is there. It's the ideological bent to green energy and what have you. But it's just so I'm not sure it would matter. I think Jason is a very good advocate for his province. He said very nice. As I said 6 months ago when I was in Alberta, he spoke very highly of Minister Freeland and the relationship they had. But it's not just niceties now. The federal government has to move and help Alberta through this the pandemic, and for them the crisis with oil prices.
I don't know, man.
Scott, the last word of this podcast goes to you.
Well, I still struggle with what the something is, because I think there's lots of political reasons that the government would be highly motivated. I don't buy the argument that there's nobody at the table. I think there's plenty of reason. Jason Kenney is a very vocal, very potent advocate. Whether you want to get along with him or whether you fear him, there's lots of reason to pay attention to him. I think the issue is, what do you do? What is the something you would do? And in some ways, the pandemic, in a major way, the pandemic has made it a much more stark policy and political choice. Because before, you might have thought that the federal government response was going to be, we have a national challenge in terms of the climate crisis and what all that means for a country that's dependent on oil and gas, and we're going to have to sink massive resources into helping that region of the country along and manage its way out. And we've made the comparison to the cod fishery in the 1990s and so on and so forth. But the implication is that there's a transition. With oil and gas at such desperately low numbers now, and I don't know how long they'll be there. I don't know what the resurgence is. I don't know what a new normal will be in terms of an oil price. I think now what do you do? Do you say, are we talking about transition? And a transition will seem like a political insult now, because the implication is we're calling you a sunset industry and then we're declaring you essentially in the throes of dying. if you take the alternative approach then and say, you know what, we're going to sink enormous resources into sustaining the industry, into resurrecting the industry. Well, how do you do that in a world where oil prices are where they are? How do you do that responsibly and say we're going to spend billions to support an industry that we don't know what it's going to look like in 3 years, much less 30. So I think the pandemic has made these policy choices a lot harder, and that makes the politics a lot more treacherous.
Thank you all. I've loved this morning. I've been so comfortable. I've been in my Bob Dylan t-shirt, my Elton John coffee mug, and hanging out with my two great friends, Scott and Jenni. Thank you for taking the time. I want to thank Jane Philpott for coming on. She was fantastic. I want to thank the Air Quotes media team for putting on this podcast and for making everything so smoothly. Tell us thank you for the phallic symbols. And and everybody, thank you all for listening. And if you liked what you heard, or even if you didn't, if you got a comment, take to Twitter, Facebook, LinkedIn, or Instagram and tell somebody about this podcast. It'll make TELUS very, very happy. Thank you all for listening, and we'll see you next week.